I know we are running a little late, so I want to invite the eminent speakers for the next panel discussion, a panel on building resilient and sustainable healthcare infrastructure. And for that, we have eminent speakers from the hospital ecosystem with us today. Let me invite Dr. Raajiv Singhal, founding member and managing director and CEO of Marengo Asia Healthcare. We welcome Dr. Raajiv Singhal. Thanks for joining us today. I would like to invite Dr. C.S. Pramesh, director, Tata Memorial Hospital, to come on stage, please. Welcome, Mr. Pramesh. I'd like to welcome Mr. Gautam Khanna, Chief Executive Officer, PD Hinduja Hospital. We welcome Mr. Khanna. We want to invite Dr. Pravin, Swamy, Chief Executive Officer, Royal Mudhol Hospital and Research Center. We welcome Dr. Swamy. Thank you so much for joining us today. I'd like to welcome Dr. Hiren, Ambegaokar, Group Chief Executive Officer of Surya Hospitals. We welcome Dr. Hiren. I want to invite Dr. Abrarali Dalal, Chief Executive Officer, Sahyadri Hospitals. Welcome, Mr. Dalal. And I would like to invite Dr. Shabana Khan, Chief Executive Officer, Prince Ali Khan Hospital. We welcome all of you on stage. And I have to play the role of devil's advocate. I'll be the moderator for this session, so I'll be joining as well. And I would also like to invite Mr. Venkat Sitaram again to join us for the panel discussion. I think we'll be needing more chairs on stage, so can we have two more chairs on stage, please? Yeah. So thank you so much, all of you, for joining us today for this exciting panel discussion. I'm sure that a kind of insights we'll be getting for next 1 hour will be very useful for all of us to move into the right direction. As we all know that the name of this panel discussion is building resilient and sustainable healthcare infrastructure. And as Mr. Naveen Sona and Mr. Venkat were saying in the inaugural session, that one of the biggest lessons learned during the pandemic has been that how we can make a resilient healthcare infrastructure. We have never talked about building a resilient infrastructure, healthcare infrastructure before the pandemic. We used to talk about sustainable healthcare infrastructure, but what about making that healthcare infrastructure more resilient? I think pandemic has all pushed us really fast to think about how the sustainable model can be resilient as well. So we would like to hear from all of you what is your perspective. So let me start from Dr. Raajiv Singhal. When we talk about building a resilient and a sustainable healthcare infrastructure, being an administrator of a healthcare ecosystem, what are the challenges? Because I'll come to the opportunity first part next, but what do you think are the challenges are there when we talk about building that kind of resilient and healthcare, sustainable healthcare infrastructure? Your thoughts on that, sir?
Thank you. Thank you very much. And once again, sincere thanks to APAC, Dell, and all the people to create this conference. Post-pandemic, I think one of the very first ones where people are here in person. So I think a great initiative. As the stage was set by Venkat and Mr. Najesh talking about the convergence part, I think the theme has been already set. It has been decided that what we want to build together, it has to be by the collaborative approach. When we talk about sustainable healthcare, I don't want to steal the thunder from my colleagues here because I think the challenges which are being faced by the industry are common to all of us. So I would leave few points and for the discussion so that people can pitch in, but I'll quickly like to pick up few points. The most important what pandemic has taught us is that creating a collaborative environment where people have to work together with each other across. They should not be working in silos, whether it is technology, whether it is one hospital with another hospital, whether it is public and private, they have to work together, whether it is the media and the society at large. I think the time has come where people have to start viewing healthcare as a giant wheel of economy. If the healthcare sector moves as you mentioned that eating into GDP or contributing towards the GDP, if the healthcare ecosystem can actually start moving and become sustainable, the nation becomes sustainable. So it's important for all of us to create the sustainable healthcare. Then comes the question of profitability and other thing. The biggest challenge is creating a sustainable healthcare, create a collaborative environment of all the stakeholders who are involved directly, indirectly, or contributing towards the healthcare sector. It's important for everyone to come on to same page, same platform, work together with the common goal of giving the best healthcare and creating the environment which can help us save lives and livelihoods. So I think that's the most important thing for all of us. So that's the major point. The other aspect is, I think, lot of effort is happening from other sectors. Having said that, I would say technology people are pitching in. Nobody thought that few technology companies will start considering healthcare as a key domain area. Government is viewing healthcare with a very different lens and trying to give the environment where we can progress and contribute towards it, whether it is the manufacturing of the consumable devices, whether it is creating the environment, creating a PPP mode. I think these are key areas where people are working together in trying to create the environment. So I would say challenges, collaboration is the first one, getting skilled manpower second, getting right environment to build the ecosystem is the third one I would put across, and obviously support from each other with the most important one.
Right, right. So let's have a perspective from Dr. C.S. Pramesh, Director, Tata Memorial Hospital. Dr. Pramesh, do you support what Dr. Raajiv has said in terms of challenges, or do you think that these challenges are not there or something else is there? Or do you think that these challenges can be overcome with re-strategizing our thinking?
I think I would largely agree with what Dr. Raajiv said. He brought on several of the aspects that I think we need to think about when it comes to democratizing healthcare in the country. To me, the essence of a resilient healthcare system or a sustainable healthcare system has to be equity. And very often we forget this. And if there is something that the pandemic has taught us, it is the point that if we don't look at equity as an extremely important fundamental aspect of healthcare, we've lost the plot. I say this so strongly and at the very beginning of my response, primarily because a lot of what we are discussing today and what we've had over the last 2 years have missed the vast majority of India's population. And I don't mean to sound like a communist when I say this, but if we were to look at what is the access to healthcare in the last mile, in the rural areas, even in the semi-urban areas of India, I think we have a lot to reach before we can claim to be anywhere close to a truly a civilized country. These are pretty strong words, but I think if we can't offer universal healthcare to the poorest of the poor at the doorsteps, I think we've completely lost the plot. And I've just come off a trip in Meghalaya where two people I knew and who I met as part of the travel had children who were under 1 year of age who had diarrheal disease, and their access to care was next to nothing. They had to travel close to 30 kilometers just to reach a primary healthcare center. And even that wasn't certain because they weren't sure whether the doctor would be there, whether the nurse would be there, and so on. So unless we cater to this entire spectrum of society, and while we might in our own ivory towers, and I'm including our own hospital in this, we might be happy treating the patients that come to us, unless we look at it from a healthcare system perspective, as a country, I don't think we are doing very well. So to me, sustainability by way of running the enterprise, and I hate to use the word consumer or customer for a patient because I think they're far more than that. Healthcare, in my mind, is not a business that we should be looking at as like in other areas of industry. But nevertheless, it's important to understand that so long as all our initiatives are patient-centric, I won't use the words customer-centric, I think that's a big advantage. So again, finally, before I end, we all speak of technology as the solution to all our evils. Look at what happened during the pandemic. If you were to look at education, which seamlessly moved from a in-person classroom teaching mode to an online mode, look at who were marginalized. they were the poorest of the poor, and there were people who couldn't afford a smartphone or a tablet. And you're actually exaggerating the inequities that we see in society, and technology has actually done that. In-person schooling was more equitable than technology. So whatever solutions we look at, whether it be tech-based, whether it be regular conventional solutions that we are looking in healthcare, I think we need to look at it with an equity lens.
Right. I'll take a perspective from Mr. Gautam Khanna. He's the Chief Executive Officer of PD Hinduja Hospital. You heard Dr. C.S. Pramesh and Dr. Raajiv Singhal. They talked about the challenges of building a resilient and sustainable healthcare ecosystem, challenges of affordability, collaborative approach, skilling, reaching to the last mile. Do you think, sir, that technology can be an answer to all of them if we use technology in more effective way? Again, hospitals, government, industry can all come together to make that transformation. Do you think that pandemic has changed that and also accelerated that kind of shift where we are embracing technology more and more to get rid of the challenges mentioned by Dr. Raajiv Singhal or Dr. Shreyas Pramesh, or do you still think that it's a long way to go?
Thank you, Souvik, for asking me a tough question. So firstly, I agree with Dr. Raajiv and Dr. Pramesh when they talked about the challenges. I just want to add one little aspect to the challenge. So when we say access, we talk about access to the physical infrastructure, we talk about access to the doctor network, so access to services, and also access to information is not there. And the last thing is access to affordability is not there. So these all things have to be addressed. Now, we know the challenges, and one of the reasons why this breaks down, when you talked about the resilience, is that if one part of the chain ecosystem doesn't work properly, everything breaks down. And I agree with Dr. Raajiv that collaboration is the way to go. And we've seen example of collaboration in the COVID time. Everyone worked together. I mean, private, government, NGOs, everyone worked together. Now, to answer your question on the technology, I think technology, one of the easiest example I can give you is the ABHA, the digital health, the patient record. Now, ABHA number, today we are not probably seeing the value of that. But think about it, that currently the power between the patient and the doctor, it lies with the doctor because he has complete information. Now, when a patient has access to his records, he needn't come to a large hospital. He can go to a hospital which is closer to their house. And most of thousands of hospitals in the country are 30 beds or 50 beds. It's a small hospitals. Now, they do not have access to maybe equipment and devices which a large hospital like ours will have in a metro. So, ABHA gives the power to the patient to go to, with the records and with the diagnosis, to a local doctor. It also gives the ability of the patient to organize into some patient groups, where they can collectively look at some solutions. They can be more research. They can also look at from the perspective of a doctor or a small hospital in a town where, they don't have higher occupancy, they don't have enough numbers. Now, suddenly they will see back. So I think the use of technology there will really help. Now, one thing which I need to caution about technology, see, we all think that technology is the answer. And I'm of the believer that technology is a great tool. It is exactly the same tool like what 50 years ago, we had a paper and pen. We used a tool to solve a problem. So I have to use technology to solve a problem. Technology is not the solution. What I do with technology is the answer. So for example, now if I am not able to provide access to healthcare to the rural areas, and Dr. Pramesh talked about Nagaland or Meghalaya. So for them, I cannot do anything. But at least if we had access to information through the phones, somebody could monitor their vitals, and maybe some remote advice can be given. At least 50-60% of the things can be managed in the remote area before they are brought to a hospital. So I think that is important. The other thing is hospitals like ours and large hospitals like Tata is doing themselves, we can offer this digital using the remote monitoring, the eICUs and so on. So we can do all of this, but for that, what is required is technology plus the will to work together. So I think I'll just stop at that and let other people comment on that.
I
Thank
think
you.
what you said, that let's look at technology as an enabler, rather than only seeing it as that technology will change everything. But technology can be a problem solver. Look at technology as enabler, which can actually help in a lot of problem solving. But again, the technology, that amalgamation of technology and physical touch has to be there in a proper way with proper planning. I can take a perspective from Venkat. Venkat, we have been hearing from the digital transformation leaders from the hospital ecosystem. They talked about challenges, they talked about the opportunities also, especially when we talk about technology innovation. Where do you see that opportunities there, or do you see that there is still a lack, still a gap is there, um, where the proper potential of technology and innovation is not has been harnessed by the hospital administrators, government, industry altogether? So what's your opinion on that?
No, that's a great question. Where do I see as a gap? Um, I think fundamentally, when you consider technology, we've seen an approach in most of the businesses that it is one size fits all. And as rightly pointed out by Doctor, that it is not one size fits all. Different emerging technologies will have a different need. For example, if you are leveraging AI in your environment to solve a particular challenge, the systems, the infrastructure or systems as we call it, should be AI-enabled system, should be purpose-built for AI. The traditional systems that we use may not support that. So this is where that, that blur has to be distinguished, and there has to be a realization that yes, the power of technology here is to give a faster outcome and desirable result. Therefore, if I were to harness what's available to me, I should be able to differentiate the one size fits all approach to a very open approach, wherein I look at purpose built systems. Now, who will get that purpose built systems? And that's where you will start looking at the technology partners, and I'm sure one name that will come, or I will request that should come top of your mind, should be Dell. So we play a pivotal role in bringing them. End of the day, I'm a sales guy, so I have to say this. I can't, I can't keep myself without saying this. So that's where we come and very clearly help identify what fits in which environment and what's the desired outcome you're looking at and how you can achieve that desired outcome. This is coming by an industry vertical experience that we've had. I must tell you, close to about 250 people in our research and development for the products that we built, right across compute, storage, network, cloud, and virtualization, are doctors. 250 people. So they bring in that knowledge domain on the great technology is not itself good enough. It has to be put to the right use. Only then you will see results, right? That's where we amalgamate all three in delivering and harnessing the best for our customers. Last point from my side. We talked about the healthcare global economy should be the biggest, and it will have an influence across the country. And again, being a salesperson, I'm a number-driven person, so I will have to share this. The current global economy of healthcare is estimated to be around $220 billion. $220 billion. It's the largest amongst the industry economies. Sooner, in about 2 to 3 years from now, which is 2025, it is expected to touch $500 billion, 500 billion, $500 billion, stand corrected there. Imagine the need, imagine the opportunity, imagine the needs of people to have a better lifestyle are the drivers which are going to drive this economy. And I'm sure all of you are doing a fabulous job in addressing this opportunity. And we'll love to partner with you and help solving some of these opportunities and challenges that come your way. Back to you, Souvik.
That's a new perspective when you talk about $1 billion. That it also gives us the feel and understanding of the size of the market you are talking about, and so many things to do, so many things can be done. Forget about world, just think about India only as a geographical geographical situation. And you talked about every aspect has got their own solution. Does not fit all. Maybe a problem in Northeast, a health problem in Northeast may not be same as in the southern part of the country, or in the western part of the country, or the northern part of the country. There are places where you cannot reach even today. Again, in those places, I think Naveen Sonaji will be in a better position how transformation has taken place or being taken place, like those fiber optical line and all. I think that future is bright, but we have to embrace fast technology. There's no doubt about it. Let's have a different perspective from Dr. Pravin Swamy. He's the Chief Executive Officer of Royal Mudhol Hospital and Research Center. So till now we are talking about that, what are the challenges and how technology can solve those kind of problems, right? But I'll ask you a different question. What about upgrading the existing healthcare infrastructure to the next level, best suited for the requirement of the present times? Let's not talk about future. What about the existing healthcare infrastructure, and how can we upgrade that to the next level, which can again, God forbid, again, no COVID comes or that kind of COVID comes, what we'll all do? Are we well prepared for that kind of uh, critical event management, if I may say so? So your thoughts on that?
Firstly, good morning all, and thanks APAC for giving us the opportunity to really talk about this subject. And I would like to give a tribute to all COVID warriors. I think because of it, I think this point has come for the discussion. When you're talking of resilience, this may go back to the preparedness of disaster, whereby the moment any impact happens, what happens? There is a response goes up. Then, basis that we develop the things, then we mitigate the risk, and then we again prepare for the second one. So we're talking of it as a holistic approach altogether. It involves your health policies first. Secondly, as sir has already mentioned about all of us are working silos, and I think we are discussing this for last 30 years I'm into this industry. Everybody is talking about it, ki we are all working in silos, but where the representation of a major stakeholder who is a patient in the health policy, where is the major representation of a woman who actually represents 50%, and as a STEM, we're talking of scientific technology and engineering and the mathematics per se, they are only 29% represented. So our health policies, sir, I think we look at you, we're talking of lot about prevention of healthcare, and we all know the primary health centers are absolutely in shambles condition. I think COVID has given us one perspective that if you see in March to May 2020, our telecommunication or teleconsult has gone almost 50 million people. Those were not, 80% of them were not computer savvy as well as that kind of. It's a queue for us to get into that. Internet of Things is another aspect to it. Now the whole healthcare is moving from hospital to home, because that 2 years, everybody has been taught that no need to go to the hospital. You can get yourself treated at home. So we talk about these problems every now and then, but thinking, why can't we use this? Because if you see the doctor ratio, because of the telecommunication, has gone up by 1:1,000. Now it has gone to 1:1,800. So I think we know we can't do much about adding people, because 60 to 80% of our major pharmacists, doctors, and the medical workers are situated in urban areas. What we all private hospital think of just strengthening our technologies, and nobody is thinking of the prevention of it. I think that's going to be the major challenge before us, and we need to look at it as a very holistic approach of looking at the health policy, whereby a lot of research and methodology should go into that, so that we always do that. I think GDP, we have to rise from at least to the 2.5%, whereby we invest more on the networking. Basically, it's good to say we have, all of us, I think all IT people, technology has given us a tool, but where is the networking? Where is the strong networking? We are grouping in dark. Why rural area cannot be provided with their all healthcare workers can represent the case on the internet, and doctors can produce that. So we need to overcome, we need to really go back to the drawing board, understand what can be done to circumvent all kind of issues and problems. That's what I come from. And of course hospitals are trying their level best, but I think my urge to the thing that we should move our whole shift from curative to preventive. That's the thing. What sir has said, that genetic is also starting from genetic, so that they will come whereby, you know, we'll come to know about the disease much in advance, and I think no need to cure the disease. That was, and that's my submission.
Right.
Thank you.
Quite interesting insight by Dr. Pravin Swamy. I think that Mr. Naveen Sona has also stated in the morning, and you also said that when that day will come when we can actually preempt what's going to happen. We have seen this kind of wonders happening for our agriculture sector or the environment sector, like early warning system. We have reduced so many damages in last 5-7 years. You can correct me if I'm wrong. I can see that that kind of thing can also happen for a country like India when we talk about preempting what kind of disease is coming. It suddenly struck my mind that we should take a bow to our ASHA workers, who has recently recognized by the World Health Organization for their tremendous work during the COVID. I think they need a huge round of applause. I think I would not have done justice if I have not mentioned them. Thanks to Mr. Dr. Pravin Swamy talking about the other people, it came to my mind. Thank you so much. Dr. Hiren Ambegaokar, Group Chief Executive Officer, Surya Hospitals, your take on this thing, sir, that how can we strengthen our existing healthcare infrastructure, hospitals infrastructure?
Strengthening the infrastructure is one of the things which has now become a necessity. If you see what we were earlier and what pandemic has taught us, is that if you lag in infrastructure and if you still remain the same old school, you can never succeed. Now, what challenges which we face? I mean, one of the things which I heard Mr. Naveen say when he was talking about in his inaugural address, I don't see nurses moving around with iPads. I don't see doctors moving around with iPads. Still, there is a lot of paper and pen in the hospital. Well, one of the challenges was the old school doctors which are there. They don't know how to use computers. They are not, and they're not ready. They were not ready to learn. But the pandemic taught them how to start telemedicine. It became a necessity. The moment it became a necessity, the urge to learn came. So it is absolutely imperative that infrastructure advancement is a necessity of life. Secondly, there's so many things which are there, like for example, preventive medicine. Now, preventive medicine is the future of the country. Now, I represent a chain which is predominantly into neonatology, neonatal care and maternal care. And one of the simplest of things which the government of Maharashtra is now doing is testing or making it mandatory testing of hearing at birth in all the nursing homes. The moment it is done and that is mapped, all the hearing diseases which are not there, not found early, are only come out when the child is in a talking age, goes to school, comes out. And by that time, it's too late to treat them. You know? So all these kind of smaller things, and believe me, India has the potential and the equipment to do it. Gene mapping, genomics, it's phenomenal. There's so many of diseases which you know which can happen, and you can take preventive actions from the beginning. If you know you have a problem which is you're going to have a liver issues in the later on, you can modify your lifestyle from beginning. That is the future. So that is the main thing. But again, like Mr. Pramesh said, equity is important. Today, what's happening? 90% of the healthcare is around the metro cities. We don't have much penetration still in the tier 2 or even in, forget the rural, even in the tier 2 and tier 3 part of the thing. And why it's not happening? Because the private sector is still not willing to go in there. And why it is not willing to go in there? It's not that the ROI is not there. It's very good there as well. But the infrastructure there is not there. The supporting infrastructure is not there. That's where we need the government to help us in developing the supporting infrastructure there and developing the manpower, trained manpower, which is one of the biggest concerns of going into the rural areas. Because you can build an infrastructure, but you can't get trained manpower. And that training is something which is there, which is important. And that is the one which will take care of the future. And that's what Gautam, my friend, is with their Hinduja hospital, they're doing that. The training is happening for the allied workforce. And that should be made more prominent. That should be made more visible. That should be made, the people in the rural areas and the tier 2 cities should be taught about that. You don't get radiographers there. You don't get technicians there. And without the technicians and the support, you cannot run a hospital. You cannot, if you don't get nursing care, you cannot run a proper hospital there. And if you want to take healthcare to the masses, we have to improve our infrastructure into the rural areas. And that's where the whole thing stands. Thank you.
Thank you so much, Dr. Hiren Ambegaokar. Again, a new perspective. And as you have rightly said, that strengthening healthcare infrastructure or talking about sustainable or resilient healthcare infrastructure is no more the mere option. It's a necessity. And a pandemic has taught us like ever before. And obviously problems of infrastructure in the tier 2, tier 3 cities and adequate skilled manpower. I think I can see a lot of you are taking note of that. I can see Mr. Naveen Son also taking note of that. And I think they also, government policy making, hospital administrators, industry can all come together. I think some steps have been taken in the last 6-7 years in terms of upskilling and reskilling of workforce. Also in the Ministry of Health website, some of the data is there that what kind of skilling work is being done. And present government's focus is also there in skilling. But yes, long way to go. And again, I think in a country like India, not everything can happen just in a matter of 2 days or 3 days. It's a continuous process. It will take time. But I think we all are moving to the right direction. Long way to go, no denying of that fact, for sure. Let's have a perspective from Abrarali Dalal, Chief Executive Officer of Sahyadri Hospitals. Mr. Dalal, your take on that, what we have been discussing for the last 45 minutes or so, that how can we strengthen our existing healthcare infrastructure? And again, is technology is going to be the game changer in that?
Yeah, thanks, APAC. I want to talk about the basic, most important assets of healthcare today or hospitals today, that is the nurse and the doctor.
I hope he's audible. He's audible to all of you? Okay.
That is the nurse and the doctor. So if you look at India today, we face shortages in nurses and doctors, even in the cities, leave alone the rural part of India. If you look at some stats, in India there is one doctor for 1,500 people, and the WHO says 1 per 1,000. Nurses are 3 per 1,000. We are 1.7. In the pandemic, this entire shortage of trained manpower, doctors, nurses exposed. And when in the thick of the pandemic, the problem became worse. Because of the pressure that was created on these nurses and doctors, they left. And there was a point, and again I'm saying not only in the rural but even in the urban areas, there was a point of time where there was shortage of nurses and doctors to even simply monitor patients, to monitor oxygen, to simply go and see, take blood pressure, temperature, and this was a big issue. And there were a lot of deaths. Nurses died, doctors died. It was very sad. Now, my question to Mr. Venkat is that can technology help here? How can technology help in ensuring that this very valuable assets, doctors and nurses, remain with us for a longer time? How can technology train them and make them more efficient? I think that's a very important point in terms of doctors and nurses. And that is the base in healthcare, because if you don't have a doctor, if you don't have a nurse in place, you're not going to be able to treat patients. A second point I'd like to pick up from Dr. CS, about, and a lot of people spoke about preventive healthcare. See, 70% of India lives in rural areas and who don't have proper access to healthcare. Preventive healthcare in the urban city is, sugar monitors. You can wear it on your arm and you can monitor your sugar 3 times a day. You have a kind of a device which will monitor your BP, and the doctor will get it remotely to figure out, okay, this is you have something for blood pressure. But 70% of India does not have basic sanitation, sewage disposal, drinking water, and mosquito problem. This is the preventive healthcare that is required in 70% of India. Because if these people did not fall sick, the load on the cities would be reduced. So I think that is preventive healthcare. So how can technology figure out how to help educate people on these 4 basic things? Drinking water, sewage, mosquito problem. And that's where the entire load comes into the urban cities. Then all your problems start from there. People coming in, tier 2, tier 3 cities don't have infrastructure. So obviously, but the government has sort of, in the last 2, 3 years, has opened up a lot of avenues for private hospitals to invest in tier 2, tier 3 cities, which is happening, but there's still some time to go. So how can technology kind of educate rural India on these basic issues? That is a challenge from my point of view. Thank you.
Again, a new perspective that 60 to 70% in India where it lacks proper drinking water and sewage and all those things. How can you talk about preventive or preemptive healthcare infrastructure? I think Venkat wants to chip in for a minute. Venkat?
I'd like to add some of the learnings that we picked up recently. I think the challenges that you alluded are, I think, well aware, and I must say, by working closely with government, this is part of NDHM. My colleague will throw light on what is the NDHM architecture. It's a digital health mission, national digital health mission. It encompasses all of these areas that you talked about on how do we go and provide access to technology, and how do we look at bridging the skill gap. And I can tell you that I'm seeing a lot of action from government around doing this by inviting healthcare leaders and the technology partners to come as a consortium and do that. Now let me give a context, since you mentioned how partners like Dell can solve this. During the pandemic, we developed Digi Healthcare app, and we shared this with all the rural. We made it available for all the rural, part of our CSR initiative. We did not promote this as part of a business line. We gave this as part of our CSR initiative. It reached several states, and I was talking to Dr. Naveen about the usage in even Maharashtra. This reached to all the nook and corners where those needy patients could share that, okay, these are the symptoms or these are the problems that I'm facing. So though there is no unemployed physician nearby, but that data, being put on a cloud or put on a central server, the physicians who are watching it, let's say from NIC, could send or could transmit information, preventive care that is needed to be taken. That's number one. So the NDHM framework is trying to really address every citizen about the wellness. That's number one. Second, Dell, in partnership with Apollo MedSkills. By the way, in saying this, I'm not promoting anybody, but just giving a small insight. Apollo MedSkills is looking at that competencies that are required for the nurses, the physicians, and all the hospital staff, skilled, not skilled, on how do we enable them on technology. So they run a lot of curriculum, and I've seen and been hearing that some of those current existing hospitals, existing healthcare, who've taken this curriculum have benefited immensely. And I'm sure, like these med skills, there are many others who are in this space. Now, if you consider these, technology in itself is not good unless you know how to use it. So therefore, when you think about an AI or a cloud or a security and ML and so on and so forth, how do I use it? Do I have my physicians, nurses trained to use it? That's where, again, companies like us come and bring those content in educating, training your staff, and in mentoring your staff on how this can be leveraged. So we don't just bring in the product only, but we also combine that with our services and then the skills that are needed to use this technology and implement this technology to the best of their ability. So it's like a comprehensive coverage, and this can only reach more and more, and healthcare can be made more accessible only when all of us partner together. Just a few people doing it is not enough, and of course government is a huge sponsor, and I'm sure they are a director here, but many of us should contribute, build a consortium to address this challenge. But I'm saying that these small steps are seen as a progress, and it's really making a difference. This is just my personal experience, because associated with Dell for the last 15 years, I have the privilege to work on nation building post-pandemic with Niti Aayog. And I've had these conversations in large forums, and I've seen a lot of participation from the healthcare community as well, and really mind-blowing when you look at the contribution and that enthusiasm and the energy that's there from a lot of CEOs saying, let's make this work. So just wanted to share that insight.
Right.
Mr. Venkat, can I
Yes,
ask you
sir.
one question with your permission?
Yeah, sure. Please go ahead.
So, you spoke about NDHM. I've read that it's available on net very easily. It on paper looks like a very fantastic system, but it is an infrastructure of hospitals, primary healthcare centers, connected to one another with the data exchange. Correct? Without that, it's not going to work. How practically possible is it to implement? For example, in today's scenario, if given a group of hospitals, I'll take my group. So we have 10 hospitals, and it's difficult for us to get data talking between those 10. Here we are talking about data flowing between not only all the private hospitals in India, but the government hospitals, primary healthcare centers. So how easy or simple is that? Another thing, today if you look at the shortage of beds, which India has in terms of healthcare, okay, 20 million beds are short in India. Okay, and it's a very known fact that almost 80% of those beds are going to be, built by private operators. So there's going to be a huge private operator, presence in that entire network. So can NDHM actually cut through all this and get data to flow amongst public, private, primary healthcare centers within the country? I mean, is it possible, and how long will that take? Until that, it remains something very much on paper, honestly.
No, I mean, it's a great question. And when we started participating on this, we did have the similar question with us. But if you look at the framework is looking at addressing the last mile, which is a needy who's in need of this service. I will give another simple example on how this can work. Probably this example will itself self-explanatory on how it can be made work. Aadhaar is working, right? Likewise, a health card becomes a social, call it, identifier, and outside India, that becomes an important identifier for a patient. That shares stats about the individual and call it the diseases or the disorders that the individual has been experiencing. Now comes a valid point that you mentioned. Can this be interoperable? Yes, that's where you need to look at technology solutions which are interoperable right at the PHC, at the block level, to the district level, and to the hospital which are connected with these blocks, the districts or taluks. So standardization, simplification becomes very, very important. So all these systems heterogeneous systems has to talk to each other, right? So there are several other orchestration tools that have come up, which is helping talk. And there is a lot of awareness that we are creating, saying, look at standardization. Don't only consider heterogeneous decisions, but look at standardization, because it's not just about the systems or the resilient infrastructure you build within. It should be able to collaborate and talk to the outside world. Have those considerations in taking those decisions, then you are building something that is flexible and that can easily interoperate with the changes that are happening in the market. So in short, it is definitely a possible. Open technologies are today allowing that, and we are prominent players in that market. And number two, it is looked at the last mile in NDHM on how we can reach out and give personal care to the last individual, because the penetration in India, internet is now like significantly caught up, right? The number of mobile phone users crossed 600 million. It was just 3 years back half of the number. Now it's crossed 600 million, and that's also a proof point. As part of this nation development that I talked about, where healthcare is to be made accessible, there is another area that government is also seriously looking at, and Dr. Naveen would know. This is about BharatNet, last mile connectivity, and education. Digital enablement and bridging the skill gap is the third one. And the fourth one is about manufacturing. I'm sure a lot of pharma companies are here, and you're looking at local manufacturing. So how can you improve local manufacturing across? So in our field, we do local manufacturing here. You should know that some of the personal computers and servers are made in India from Dell, from Chennai facility that we have today, that we ship to a lot of customers here. So this is something from a nation building framework that most of the corporates like us are really looking at, contributing and helping bridge the skill gap and giving access to technology.
Right. I think Dr. Shabana Khan has been patiently hearing us for last 1 hour or so. Before I should not say anything because I think let's hear from her, her vision, her perspective on the sustainability and resiliency for the healthcare infrastructure. Dr. Shabana Khan is the Chief Executive Officer of Prince Ali Khan Hospital. So over to you, ma'am.
Thank you so much, APAC, for inviting me on this forum, and it's an honor to speak here. So as far as I think the topic was that building a climate resilient and an environmentally sustainable healthcare system. So I think the first important thing is having awareness. And honestly speaking, when I got to hear of the topic, I thought, let me do some deep diving into this thing. And actually, there is a WHO document on this topic. And it essentially speaks about four basic pillars of the operational network. One is the healthcare workers. The second is energy. The third is WASH, which is water and sanitation and hygiene. And the last is healthcare technology and products. So every individual framework content needs to be assessed individually. And each of the parameter has got its own challenges. The important thing is driving this initiative. And we are happy to say that in the AKDN network, we have a mandate of net zero carbon footprint by 2030. And this thing has come from our leaders and taking a cue from, of course, the COVID pandemic, which taught us many things. It's not that the pandemic is over. Yes, we are going to have, because of climate change, more and more things which are going to come in, and we all have to be prepared for that, whether we like it or we don't like it. And that is why getting the leadership team of the hospital and collaborating, as rightly said by Dr. Singhal, is very, very important. It needs collaboration between the private healthcare providers as well as national bodies and government bodies and many other technology providers as well. Having said that, we need to set the baseline, which is what we did in our network, as to setting the baseline of where we were as far as building our environmentally sustainable and climate resilient organization. After we set the baseline, it's then we do a vulnerability testing as to how vulnerable we are, doing an assessment. And there are various toolkits which are available for that, which WHO provides. We, of course, follow a toolkit which is provided by our corporate office. And then taking various initiatives in each and every I would say vertical, whether it be energy. So yes, we speak about energy consumption, moving to cleaner and greener energy, building a safe and clean hospital, doing a stress testing of the hospital as to how vulnerable we are. And also there is a hospital safety index as well. So these are all available. And I think when we say technology, and yes, technology, I mean, it goes without saying that it helps. But why is technology? One thing why technology is also important is the fossil fuel that we consume in transportation, etc. I think that contributes to a great extent to the greenhouse gases, which is going to cause climate change, which is going to cause pandemics, which is going to, have impact on the entire healthcare system. You're going to have floods, you're going to have droughts, and you're going to have, limitation of resources in various areas, more so in the interiors of India where resources are not available. So how do you use technology, decrease the minimization, minimize the usage of fossil fuels, use technology, telemedicine, electric vehicles, those kind of things are really, really like one of the things which we did was again budgeting, because again you need to have awareness, you need to have capacity building, you need to have, I would say, educating and having champions in every division to drive this thing. So I think that is how we as an organization are participating in this initiative.
Right, right. Thank you so much, Dr. Shabana Khan, for again giving a new perspective. And the document you're referring to of World Health Organization, that document in one index, it also talks about the importance of emerging technologies to transform healthcare ecosystem world over, which has been one of the biggest learning according to WHO, along with climate resilient, sustainable healthcare model. So thank you so much, all of you, for joining us today and sharing your thoughts, inputs, perspective on how we can make a sustainable and resilient healthcare infrastructure model. And I'm sure deliberations made by all the experts today will be of very importance to create a document and to circulate with the stakeholders. It's not that this is just the beginning, not the end, because we are going to take this forward to all our stakeholders, be it in government, to in industry, to the hospital owners across India, so the documentation actually reach all of them. And I'm sure some part will be taken from there when actually they make the next set of healthcare policy. Thank you so much. I'd like to invite Mr. Gopi Arora to come on stage and hand over the mementos to our eminent speakers. We can start we can start with Dr. Shabana Khan. A big round of applause for her, please. Chief Executive Officer, Prince Ali Khan Hospital. Gopi, if you can come on stage, please, and hand over the memento to Dr. Shabana Khan. Thank you so much for joining us today. To Mr. Abrarali Dalal, Chief Executive Officer, Sahyadri Hospitals. To Dr. C.S. Pramesh, Director, Tata Memorial Hospitals. To Mr. Venkat Sitaram, General Manager and Geo Head, South India Corporate Business at Dell Technologies. To Dr. Raajiv Singhal, Founding Member, Managing Director and CEO of Marengo Asia Healthcare. Thank you so much, Dr. Singhal, for joining us today. To Dr. Pravin Swamy, Chief Executive Officer, Royal Mudhol Hospital. Dr. Hiren Ambegaokar, Group Chief Executive Officer, Surya Hospital. Gautam Khanna, Chief Executive Officer, PD Hinduja Hospital. Critical position, no? Dr. Pravin Swamy, Chief Executive Officer, Royal Mudhol Hospital Research Center. And to Dr. Hiren Ambegaokar, Group Chief Executive Officer, Surya Hospitals. I think I have covered all. Yeah. So, and can you have a group photo with all the panelists together, please? If you can take the mementos in your hand and have a group photo. And let me play the role of devil's advocate all now, because Venkat was saying it's not about only Dell. So let us thank all our partners for this wonderful event which has been taking place. Presenting partner Dell Technologies and Intel, and gold partners Newman, Citrix, associate partners Emurata and Pinnacle. Thank you all our partners for making this event possible, and all our esteemed speakers and delegates who have been part of this first half of the event. And for the next set of the event, I'd like to invite Mr. Rajneesh Dey, Consulting Editor of APAC News Network, to make the announcement. Thank you so much, all of you.